that would be called 3D conformal radiation. And although that was a huge advancement, that already is old technology. Since then, and going back into the late 90s, we developed what's called IMRT, which is intensely modulated radiation. So it's an advancement of 3D radiation, and that we create all these different shapes of beams. But with intensely modulated radiation, from any single beam angle, we will treat, instead of just one area, we treat, in this case, let's say 7 areas, and they're all different shapes, and one goes over another, so that when we look at the dose, intensity dose profile of the beam, it varies, so that parts of the beam area are getting high doses and other parts are getting low doses. And that's why we call it intensely modulated radiation. We're changing the intensity of the beam across the area. And then we do this not from one angle, but from 7 angles or 9 angles. And that allows us to shape the beam to the shape of the tumor. And here is sort of a movie representation of that, in that you have different shape areas of beams, and the doses are applied one on top of the other, but they overlap in different areas. So that by the conclusion of treatment from a single beam angle, there are certain areas that receive high doses and other areas that are receiving low doses, just in the red. And then again, when we do this from many different angles, we're shaping the dose of the beam. And then when we look back on our planning system, what we're able to do is we're able to ensure that the target, the blue and the yellow here, receive high doses, but then, for example, the eyes, which are up here, are receiving very low doses. So we're shaping the beam, and then in graphical form, the way we evaluate a plan is that the target, which is, we look at this here, 100% of the target is receiving a high dose of radiation, but the critical structures are receiving very low doses of radiation, because on the bottom axis here is the dose delivered to the tumor. So that allows us to treat what we need to treat and minimize dose to the critical structures. Now, tomotherapy is a unit that is even a little more advanced than what I discussed as IMRT. This is still IMRT, but it takes it another step further into the realm of what we call IGRT. And tomotherapy is basically a CAT scan machine that is combined with a radiation delivery machine. And I mentioned before with IMRT that we often come in from 7 or 9 angles. With tomotherapy, the radiation delivery piece spins around as the patient goes in through the hole in this machine. And basically we treat from virtually 360 degrees, which gives us more ability to shape those beams. And in addition to shaping the beams, every day before treatment we do a CAT scan, which I'll show you an example of in a minute. So again, here's an example of a tomotherapy machine. This is what it looks like from the outside, but from the inside it is significantly more complex with a lot of different technical components to be able to provide this technology. Now, when we do the daily CAT scan, if I treated someone years ago before I had tomotherapy, I would do IMRT, and we would take weekly x-rays to just visualize the bones of the skull, make sure that they're in the same position. With IGRT, every day the patient comes in, we put a mask on to hold that head in the same position, and then we do a CAT scan. And what we have here is an example of, in the gray was the original CAT scan, the first day that we made the mask, and in the blue was the daily CAT scan. And on the computer, while the patient's on the treatment table, we overlay the blue and the gray scans, and we line up everything so you can see the bones of the skull line up, and we know that the brain is in exactly the same position. And we don't only use this technology for brain tumors, we use it for many other types of cancer also. But it allows us to actually visualize the area and know that everything is lining up precisely. And then we deliver the radiation. So we use the images to make sure we're accurately delivering the radiation. So it's image-guided radiation therapy. Tomotherapy allowed us to start treating multiple brain metastases, and I know Dr. Sim's going to be speaking more on the treatment of brain metastases and some of this localized radiation. But it allows us to treat multiple brain metastases in one sitting. Although more recently, we started our Gamma Knife program, which even brings the level of accuracy up another notch, which I know Dr. Sim is going to address. But here's an example of a patient with 4 lesions in the brain, and you can see them here on the scan. And then just as an example, after treatment, we see dramatic improvement. It looks like 3 of the lesions have responded completely, and this one got significantly smaller. Another thing I always tell my patients is successful treatment doesn't always necessarily mean that the scan has to be perfectly normal. Meaning we can often kill cancer cells, but that doesn't mean that the body is able to take them away and remove those dead cells from the scan. So sometimes something can shrink down but still be seen, but that doesn't mean it's active cancer. So if we continue to follow a patient and this stays stable, scan to scan to scan, it very well may be dead or inactive tissue that the body just hasn't cleared, and that's fine. What we really often define as success is as long as nothing is growing, it may very well mean that there's nothing active in the area.